Hello, Facebook. It is 12:30 on this Friday afternoon. That means the doctor is in. Once again, we're happy to welcome back Dr. Joanne Baird with Bayside Orthopedic. Dr. Baird, thanks for being with us.
Thank you for having me.
We're talking about a topic that a lot of women can relate to, orthopedic problems during pregnancy.
Yes.
You know, when you're pregnant, you have so many aches and pains. You don't know what's normal, what isn't. And so let's just start by talking about what are the common orthopedic problems that these women experience.
So number one, low back pain. Obviously. Pelvic pain or osteitis pubis. We also see transient osteoporosis of the hip, plantar fasciitis, carpal tunnel syndrome, de Quervain's tenosynovitis, lateral epicondylitis, and I know I'm forgetting some.
I mean, that's a lot of...
Yeah, patellofemoral knee pain.
Wow.
And a lot of these are also, we kind of cluster pregnancy as well as early motherhood together.
And why are pregnant women more prone to these problems?
So the added weight of the baby in their belly obviously causes problems as it grows in the uterus. This stretches the abdomen, weakens the abdominal muscles, puts more strain on the lower back. We also have hormone changes. So the whole point of pregnancy is to get us ready to deliver a baby and basically prep our pelvis. So our pelvis widens, our ligaments stretch, our joints stretch, and they get weaker. This loosens the joints even in the lower back as they connect to the pelvis and then to the legs as well. The added birth weight of just what we put on is to support the baby. We're eating more nutrients. We all gain weight as pregnant ladies, and that puts more strain on our joints as well.
So let's talk about these. By the way, if you are watching us here on WKRG's Facebook page, we hope you will type in your questions and I can ask Dr. Baird if you have any questions about being pregnant and having orthopedic problems, or you just have an orthopedic question. She's also here. We've got her attention right now, so
yes.
Go ahead and ask your question. All right, so you talked about all these different problems. Do most of them go away after you've had the baby?
Fortunately, yes. Moms, there is a light at the end of the tunnel. The aches and pains do go away for the most part. Majority of back pain will resolve after you deliver. Additionally, carpal tunnel does tend to get better even after you give birth, as well as plantar fasciitis and all the other itises. With the exception of some, they will kind of persist into motherhood because now we're lifting a baby up and the baby grows and adds more weight, and we're doing exercises, a lot of repetitive things that we weren't used to doing, picking the baby up out of the stroller and putting them in the chair and in the crib and stuff, and so you get inflammation of the tendons at the wrist and in the elbow, sometimes even the shoulder. But for the majority of the part, a lot of these things will get better. Transient osteoporosis of the hip tends to get better, pubic pain, pelvic pain, etc.
I mean, that question is, and I know you have a child, I have two children, but a lot of women wonder what's normal, because you don't want to call the doctor every day. I feel this, but how do you know when it's something maybe isn't normal?
So, every pregnancy is different, and moms that have had two kids, you can't say the first pregnancy I felt this and the second pregnancy was exactly the same, because the majority of the time they're completely different. The number one thing is you always want to consult with your obstetrician. Your OBGYN is first and foremost number one to go to. Majority of back pain is benign, but it can be a sign of problems in the pregnancy, ectopic pregnancy, preterm labor, problems with the placenta, etc. So you always want to talk to them first. The other thing that I've found even during my pregnancy and early motherhood is, moms always want to talk to other moms and give their advice. And they want to talk about, oh, this is how you swaddle the baby, this is the best nipple, but they never talk about the aches and pains you feel, except, oh yeah, my back hurt, and they kind of brush it off, and then you feel it's not important, but it is. And so bring it up to your OBGYN, they will refer you, come see us. As an orthopedic, we can guide you through that and help, because there are things we can do to make those pains better, because when you hurt, it contributes to all the other stresses of pregnancy and that of being a new mom and the postpartum depression, which no one wants to talk about.
Which is so real.
It's so real.
So do you recommend, we've talked about you have all these aches and pains, come see an orthopedist while you're pregnant? Because you're right, you don't know if it's something, and if, let's say you have a disc problem, a lot of people have bulging discs or different disc problems. Is that something that can be fixed while you're pregnant, or do you really need to wait?
So the majority of time it's things that we can wait. The good news is the majority of back pain is not sciatica in pregnancy, where it's a pinched nerve. That's rare and usually only about 1%.
Oh, really?
60% of back pain in pregnancy will get better, and it's muscle sprains or strains just because of the weight.
Okay.
And so a lot of times we can wait and let it kind of resolve, because it will go away after pregnancy. However, there are things we can do to make it more comfortable. Heat, ice, stretching, prenatal yoga, prenatal massage. There are various things. Even prenatal acupuncture can be safe and can help with a lot of the aches and pains.
So you don't want to just suffer.
Don't suffer.
Go to the doctor.
There's enough in this life to suffer about.
Exactly. Well, Dr. Baird, let's talk about where you're located. You're with Bayside Orthopedic. Where is that?
So we are in Fairhope, Foley, and Gulf Shores.
Okay.
We also have a clinic up in Bruton, but we're just in, over the border in Baldwin County, just over the border of Florida. I actually live in Pensacola.
Okay.
So people in Pensacola, it's not that far. It's 30 minutes. And, with that bridge being out and continuing to be out, it can be hard, and, there's a lot of traffic, and it's an easy drive even to Fairhope from a lot of Pensacola.
Right. So they could just pop on over to Baldwin County if you're watching us from Pensacola. That's definitely a great option.
Yes.
Okay, we're getting a question here from Kristen. She says, when I was pregnant 4 months ago, I needed the surgery. Speaking of back pain, I called your clinic for back pain, and I was informed there was not a back pain specialist. It sounds like all orthopedists are back pain specialists, aren't they?
To a degree. So, and that's correct. We don't have a spine surgeon. So what we limit a lot of the back pain that we see because 98% of Americans have back pain. But we can manage non-operative back pain to a degree and are happy to do so. If it's something that is surgical, however, we as a group don't have that surgical expertise.
Right. But there are so many things, because surgery really is the last option.
Yes.
You don't want to have surgery.
No.
But so you need to come in and get it checked out because there may be a life you mentioned.
And the majority of the things that we can do for other things during pregnancy, we can do injections. We can't do back injections per se, but for carpal tunnel, tennis elbow, et cetera, steroid injections are perfectly safe during pregnancy. We can do that and help out and kind of manage the symptoms, and then if it is something that persists, we typically want to wait till after pregnancy and then we can pursue surgery.
Right. Okay, so lower back pain. You talked about that a little bit. Terry is asking about, is there someone who's more at risk for lower back pain during pregnancy?
So if you've had low back pain prior to pregnancy or with a previous pregnancy, you're at higher risk.
Okay.
More sedentary individuals, less flexible individuals, higher BMI are at higher risk.
Okay.
For low back pain typically.
And can you take, I guess that's the biggest thing. I remember I tend to take Advil, and I had to really limit that when I was pregnant, which is, hard for people. You don't want them to take too many things.
So that's where, I always say ask your OBGYN. They usually will go over what meds are safe, and certain ones will be safe for one lady and not for another one because of their pregnancy.
Right.
As young mothers, if you're still breastfeeding, Motrin is a very safe anti-inflammatory that you can take for some of the aches and pains. Heat is also a very good extra modality, and sometimes the topical creams can help, whereas you're not taking an oral pill, so the systemic absorption isn't as significant.
And then let's talk a little bit about working out.
Yes.
That is not something that needs to stop when you get pregnant.
No, they actually are now recommending that you continue your normal exercise prior with a few modifications, especially as pregnancy goes on. You want to focus less on abdominal work and sit-ups in the second and third trimesters because of the increased size of the uterus.
I don't even think I could have done a sit-up when I was, I just don't even think that was possible.
Yeah,
with
a baby, I don't know how people could, but there are other ways to get core strength. Yoga is definitely safe. You want to stretch. Walking, cardio, if you were a runner before, you can be a runner during pregnancy as you can tolerate it, but it's important to listen to your body. And if something hurts, you're having pain or spotting or bleeding, you need to stop and immediately touch base with your OBGYN.
Terry is circling back here about lower back pain, and she's saying, what treatments do you offer for low back pain?
So typically stretching, you want to focus on your core, which can be hard again during pregnancy, heat and ice. And then they even have bands sometimes, braces, so to speak, that are specific for pregnant females that can help with that low back pain. I know I was in fellowship and practicing, and I had to wear one for a good portion of my pregnancy, and it made a significant difference.
Okay, Jennifer is asking about pelvic pain. Pelvic pain is the worst. Are there exercises for that?
Yes, there are. Again, similar exercises for the back in doing stretching the back, the cow and cat type thing for yoga, abdominal lifts. I don't know, specific good ones to be able to kind of talk about in verbal, but
if you come in, you can talk about it in a little bit more detail.
Exactly.
But there are some things you can do.
There are some things you can do. I know during my pregnancy, my SI joint pain was just terrible. And a lot of it, unfortunately, is related to the hormones and those ligaments stretching, and there's limited things we can do, but finding what activities aggravate it, avoiding those activities while trying to stay active. Staying sedentary with back pain and pelvic pain is not recommended.
Right.
It really doesn't
That's
help.
the thing, you want to kind of lay around,
Right.
but really you got to get moving. I mean, that's
Correct.
I say that all the time about so many times we don't feel like it, but
Yeah.
that's the best thing you can do. Get
Yep.
moving.
Get moving.
Okay, we're getting another question here from, let me go back here. Well, and I'll ask this question from Amy, and then I'll find the other one I saw. She's asking about physical therapy. Does your physical therapy department have a regimen for women after pregnancy if they need it?
We do, and there's plenty of exercises, and we have physical therapists at both of our facilities in Fairhope and Foley that are very good and well trained. Other things for pelvic pain specifically, there are physical therapists focused specifically on pelvic
Okay.
physical therapy.
Oh, that's good to know.
They are fewer and farther to find, but I do know of some that are in Pensacola, and they are a great realm of help for women that kind of have that chronic pelvic pain.
Okay, let's see. I'm trying to find that other question that I saw just a moment ago. Okay, Angie, she's asking, what do you offer for leg pain? Which is kind of, yeah, Angie, that's a little bit...
It's a little vague.
Vague, yes.
I will say a common leg pain that young mothers, but not just young mothers, many women are that anterior knee pain or patellofemoral syndrome, a lot of which can be helped with strengthening and stretching. Patellofemoral syndrome is kind of a catch-all for vague anterior knee pain related to subtle problems of that patella not tracking perfectly in the femur, in the groove on the femur. And so strengthening the quads, the hip abductors, and core are going to be core to that.
Right. It's just, but sometimes people don't even know where to start. They don't really know what exercises to do. And so do you recommend maybe maybe go to the orthopedist, maybe ending up with physical therapy can kind of give you a plan that even you could follow at home? Is that,
Yes.
do people do that?
Yeah, a lot of therapy, physical therapy is great, having that supervised guidance to show you properly how to do the exercises, but a lot of it is work at home too. And so a combined home program with some occasional supervised therapy is probably the best.
Okay, and Amy is asking another question here, and I think a lot of people can relate to this one. She said she had pain with one shoulder that she used to lift her son on the right side. So everybody has their side where you like to put your baby. I mean, I could put a baby on my hip and do 10 other things, and then it was that side. So what do you recommend for something like that one-sided?
Try switching to the other side.
I know, it's hard because I always say my left arm was just not strong. And it's
true.
Still not.
I mean, we have our dominant, and you're used to using, mine, the funny thing is my right arm, because I'm always doing things with that while I hold her in my left, you'd think my left hurt because I'm holding her that side, but it's my right arm that I've had the tennis elbow and the bursitis.
Oh, really?
But as much as you can try switching them from hip to hip, learning to use things, do more with your non-dominant arm, so you're balancing it, because it's all usually related to overuse. You're doing too much of the same repetitive motion on one extremity.
Because they like to be held, so
Oh,
they're
they
not
do.
going to cry and you can hold them. I remember
they do.
cooking dinner with this and then going over here, just whatever I had to
You
do.
get very skilled one-handed.
Yes. Right. Okay, so let's talk a little bit about, well, Erin is asking a question here, and this is common, and you mentioned this. She says she has carpal tunnel during pregnancy in both hands. She said she still experiences numbness in her left hand, specifically at night. Is that normal?
So yes, as much of the time as carpal tunnel will get better after pregnancy, there are some that it will persist. It's also a very common complaint in people that throughout all of life that never even had a kid.
Right.
So, unfortunately there are some that will stick around. Night splints, anti-inflammatories are a good thing to start because a lot of it is positional, which will aggravate it. We sleep with our hands kind of in one way or the other under our pillow, which aggravates and stresses the nerve and decreases that space. Steroid injections from an orthopedist can help, and then essentially post-pregnancy, then working it up with a nerve conduction study to see how bad it is compressed, and then a surgery, which is fairly straightforward and quick as an outpatient procedure.
Well, so you mentioned a lot of these problems will go away after pregnancy. Could that one go away after pregnancy, carpal tunnel? So you're saying if it doesn't, then you can
If it doesn't, yeah.
But that is hard to, you mentioned, the way we sleep, and sometimes we just sleep the way we sleep, but you're
Right.
recommending sometimes people will wear actually splints at night.
Yeah, a little brace that's removable that helps just avoid them getting in that position.
And then you touched on cortisone injections. Is that something that you can do while you're pregnant, or what about when you're breastfeeding? You can do, both you can.
Yeah, there's minimal systemic absorption, and it's been deemed generally safe in the majority of patients. Now, I would say to use caution if you are gestational diabetes potentially, because steroid injections will elevate the blood sugars temporarily. So I would always caution any pregnant woman to first ask their OBGYN. There may be some other medical condition that we're not aware of that may, kind of contradict or make them, not want to do that. But majority of the time it is completely safe.
Right. Now, what about Nsaids while pregnant? Are those recommended? I guess
it depends on the trimester. It depends on the pregnancy. So I would defer to your OBGYN to ask. And certain ones, like Motrin, I know this, and a lot of it depends on the studies and what they've studied with that medicine. So they can say this one is generally, that one may not be.
Right. Okay, well, we've gotten a lot of really great questions today. Dr. Baird, so once again, if folks are watching, you did a fellowship in sports medicine.
I did.
And I know you treat both men and women, but you do have a particular interest in women's health. And so if people are interested in coming to see you, are there some common things that you deal with, just not with pregnant women, just women in general?
Rotator cuff, shoulder problems, even some elbow pain, lateral epicondylitis. I do PRP, steroid injections, knee problems in particular, even ankle, some foot and ankle stuff.
Right, so a little bit
of
everything. But it is interesting, conversations we've had to talk about women's problems versus men's problems, and how our bodies are different, and how the problems sometimes are different as well.
They are.
All right, well, Dr. Joanne Baird has been our guest today for the Doctors In. Again, Bayside Orthopedic.
Yes.
Tell folks where you're located again.
Yes, so we are in Fairhope, Foley, Gulf Shores, and occasionally in Bruton.
And is there a particular place where you tend to practice more, because there's so many locations?
So many locations. Every week I'm in both Foley, Fairhope, and Gulf Shores, so I'm all over the place.
Okay, so they can schedule with you depending on where they would like to see
Exactly.
you. Okay. Again, Dr. Joanne Baird, thanks so much for answering all these great questions today. And thanks to all of you for watching The Doctors In. I'm Devin Walsh. Have a great afternoon. I'll see you tonight at 5.